From the Historyogi Podcast, this is Dave. AIDS is an illness that still carries social stigma and moral indignation. The situation was especially worse during the 1980s and 1990s, when most patients died painful deaths and moral panic influenced public rejection of those from marginalized communities. Today, we speak to Professor Roy Chan, President of Action for AIDS, on the early fight against AIDS in Singapore, its impact on the gay community, how things have changed since then, and what Singapore still needs to do to decisively defeat the disease. Thank you very much, Prof. Chan, for joining me today. What is your medical background and how did you first get involved in AIDS related issues in the 1980s?
So, in the 1980s, I had just completed my postgraduate specialization in dermatovenereology. In fact, I was in London during the mid 80s, early to mid 80s, when AIDS first came onto the scene, and this is in the UK. And even then, when I was there and I was doing a dermatology venereology, it wasn't such a well-recognized condition because the cases were just beginning to surface. So I came back to Singapore in '85, having completed postgraduate training, and started work in the Middle Road Hospital, which is the old hospital in Middle Road, which was looking after skin and STDs. At that point, we started to diagnose the first couple of cases in, I think it was '85 in Singapore. And soon following that, the test was invented to diagnose HIV in the blood, antibodies against HIV in the blood. So that was my background. My background was very much involved with sexually transmitted infections. And it was quite clear that AIDS was very much an STD in those cases, and it still is now. So that was how I was involved as a young junior consultant in the department, very much involved in looking after patients and also to do with education and prevention and so on.
When the earliest AIDS cases in Singapore were diagnosed in 1985, what were the reactions of the government and the public like? And what was the typical scenario facing a newly diagnosed patient at that time?
So in the 80s, when, I think if we look back on some of the published newspaper articles, magazines, there was a huge amount of fear and terror regarding AIDS. And in those days, because of the lack of understanding of what it was in the first place, it was called various things. It was initially, certainly in the West, it was diagnosed initially amongst gay men. So there was a huge amount of stigma associated with that. Plus, it was a sexually transmitted disease. And because of the fact that it was a sexually transmitted disease and found predominantly in gay men, and then also found in certain in Haitians in those days, and also then blood transfusion recipients, IV drug users, it was very much a disease which people were fearful of and had a huge amount of moral indignation about. So people with diagnosed with HIV or suspected with HIV and AIDS, they were hugely discriminated. I think the reaction of the general public and even the authorities was one of fear, and there was a lot of rejection. I remember that patients who in those days were diagnosed and they had to take taxis to a certain hospital. The taxi drivers often didn't want to take them. And remember that in the 80s and 90s, there was no really good treatment for HIV. So people were dying. Patients with HIV had basically, 95% of them didn't have any chance of surviving more than a few years. And they died very, very painful, very, I would say they suffered a lot. There was a significant amount of skin manifestations. They lost weight. There was all sorts of opportunistic infections of the lungs, of the gut. So, I think there was a huge stigma around people with AIDS.
As a medical professional, what were the reactions of medical staff, and such as doctors and nurses, during the early years of AIDS in Singapore?
Oh, I think a mixed bag. Like everything else, there are those who are much more supportive, and I think the people who are in the specialty infectious diseases, STIs, were much more proactive, much more supportive. I don't want to stereotype or want to just paint over. I think that there would be some who were less supportive and didn't want to look after patients. There were nurses who didn't want to stay and work in the HIV wards. But then again, there were those who felt that they found their calling. So a mixed bag. I think that thankfully the epidemic, we could keep it in check in Singapore, and our ability to reduce to keep our epidemic very small has been, a lot of it is because we never took our eye off the ball. We have been working on this for very long. We didn't stop. We didn't take our foot off the brake, as it were. And we've had the ability we've been able to really work together with our colleagues in government and other groups. And we've always, kept it on the front burner, so to speak. Increasingly difficult now. So, because of all the competing interests of climate change and COVID, and also the fact that now it's no more fatal, so it's not really sexy in a sense anymore. But I think that there's still interest to really further stop the transmission of HIV, so that it's something we can actually relinquish to the disease of the late 20th century. So that's I think our target. That was why I started AFA, Action for AIDS, because I thought that the authorities didn't have very much of an idea how to reach out, how to access, how to provide education, prevention, training, awareness building, and mobilization of people that were needed to mount a proper response. So with the blessing of the ministry and I got together with some colleagues of mine and also friends of friends who brought in professionals with different qualifications, and we started Action for AIDS in 1988 was registered, and it's sort of continued to grow since then. So we filled a niche, which was a gap, which was missing, particularly to do with prevention, education, outreach programs, and getting to people who needed the information. And we also we needed to talk about condoms. In those were the days where we couldn't say a lot of things in public. There were no public campaigns on condoms. So was always left to the non-governmental organization to handle very sensitive matters to do with sex, to do with gay men, to do with sex workers, to do with people with multiple partners and so on. So we felt that we needed a lot more than just medical professionals to do that. We needed people from the community, people with skills in public relations, in advertising, and in all sorts of, in art, designing relevant, accessible materials which spoke in the same language as our target audience. So as an NGO, AFA had a lot more leeway, a lot more. Our mandate and our ability to provide accurate and frank and understandable, targeted information was what we had a lot more of that ability to do. So we started with a few things. We started with campaigns talking about the safer sex and condoms. And in those days, when we started talking about condoms and safer sex, there was a lot of opposition from conservative groups, religious groups, saying that we cannot be talking about condoms, we cannot be talking about this, that, and the other. And so we had to. It was almost every few months there would be forum letters, and we had to always rebut. So over a few years, that was what we did. We were trying to change public perceptions and ideas about education and what we need to do. We can't bury our heads in the sand. We can't say we can't do this, we can't do that, and therefore, so we took on that responsibility to make sure that accurate information was provided for our target audience. So that was one, education. The second objective, which we wanted to do, was to provide care and support. So we mobilized volunteers who would make visits to patients in hospital or at home, provide them with food and just care and support. Bearing in mind that, as I mentioned earlier, in the 80s and 90s, there was very little treatment. So all we could do was treat the complications like infections and cancers. There was no really good treatment for stopping HIV from multiplying in the infected person. And so a lot of it, at the end, was also palliative, was also care and support from that point, also support of the families and caregivers. So that was the other thing. And then the third area which we focused on was advocacy. And it was advocacy from the point of the patient, so patients' rights to access care and decent and fair treatment and medications was important. Advocacy for against discrimination and stigmatization of people living with HIV. So we highlighted clear instances of unfair treatment and so on. So those are the three main areas, and all our programs and activities could fall into those three main areas.
You mentioned earlier about how AIDS was portrayed as a sort of gay disease in the early years. How did this hinder outreach and treatment efforts targeted towards this community, and how has the situation changed since then?
So I think that the way it hindered was that because it had this label as being a gay disease, people who didn't think that they belong or were like straight felt that they were not at risk, which was clearly a fallacy, because in Singapore in the 80s and 90s there was gay disease, but more and more there was a heterosexual epidemic as well. And so it hindered that from that point of view, in terms of people who were straight and who had multiple partners didn't think they were at risk. So that was how it hindered. I think that from the point of view of reaching out to gay people, I think that we tried our best to mobilize the community and supporters. Initially, also, that I think that if you look at the history of AIDS, certainly in the US and Western Europe, there was a lot of reluctance and denial at very high levels of government. The US and the funding agencies didn't bother about treatment, about research into medications. And in the West, there was a huge mobilization of the gay community that forced the issue, that made the government put more money into research, into treatments, into coming out with medications, coming out with tests and so on and so forth. So I think that initially in the West there was a huge denial of the fact that the disease was ravaging through certain parts of their societies, which were discriminated, which were marginalized. And so as was in Singapore, I think that in Singapore I think that a lot of the reaction to HIV/AIDS in the 80s was one of fear. Okay, and fear gave rise to enactment of several legislations which was thought would be helpful in preventing spread of HIV/AIDS. And so, the legislations in the 80s and 90s we still have today. And we feel that, I feel, and many of my colleagues feel as well, that it might be time to review these legislations, because laws which were enacted in a time where people, out of fear and out of a knee-jerk reaction to something which was relatively unknown in those days, may not be such a good idea now, because we know definitely how HIV is spread and so on and so forth. Things have certainly changed. I think that over the last 2 or 3 decades, the medical science has yielded incredible number of treatments, so much so that AIDS is certainly not anymore a death sentence. It's been shown, in fact, that person with HIV, if they are receiving optimal treatment, optimal care for the HIV, can live as long as a person without HIV. So it is changed from a practically uniformly fatal infection to a condition of chronic illness. So the outlook for patients is much improved because of the advancement of medical science and so on. Okay. The perception that it's a gay disease certainly has continued in some sectors, but I think that over the years we've been trying to correct that perception. It only affects gay people. I think people are quite clear that everybody's potentially at risk through unsafe sex with an infected partner. It could be any partner.
You mentioned earlier about some of this legislation that date back from the earlier years. Could you cite some examples?
So I think one example, I think which we are still grappling with, is the use of Infectious Disease Act to criminalize people with HIV who may have unprotected sex. things have changed incredibly, because I think that there is a quite clear scientific proof that people who are taking antiretroviral medications and are optimally treated have an undetectable viral load, and it's been shown conclusively in several large-scale studies that they are not infectious to other people, even through unprotected sex. So we need to make changes to our understanding and how we use the Infectious Diseases Act, so that a person with HIV is not treated as a criminal. I've always also said that when we are talking about sex, it takes two hands to clap. So I think that it's just not left to the person with HIV who might be maximally optimally treated to ensure that there is safe sex. There is the other partner, and people should also take that responsibility in their own hands as well, to make sure that they take precautions. So I think that we need to be very careful when we apply the Infectious Diseases Act to criminalize people with HIV. So people with HIV are not criminals. They are people with an infection, okay, and they should be treated as such. Another thing is the use of condoms, for example. We should really take use of condoms as being responsible behavior. I think we need to be very careful about using the law to stop HIV/AIDS, because it might have a negative effect in terms of further stigmatizing people with HIV. So that, one of the issues we have and continue to have is, how do we get people to come forward to test? If you look at the most recent, even up to 2020, 2019, almost half the people who are diagnosed with HIV are diagnosed at a stage when they are already seriously immunosuppressed. That means they've been infected for several years. Over the years, we've been trying our best to encourage people who feel that maybe at risk to come early, because the earlier one gets tested and diagnosed, the earlier one gets on treatment, the better the prognosis is. And not just that, once a person is on treatment, they are no longer infectious. So if we can get everybody who is at risk to come forward to get themselves tested, we can actually literally stop the transmission of HIV in the community. But we haven't been able to do that. I think that mainly because people are still very fearful of being diagnosed with HIV. So the stigma is still there, although it might be less than it was. Okay, there's less fear, but there's still a lot of stigma. The stigma of being diagnosed with HIV, or of being known to be a person living with HIV. Many of our patients don't talk certainly don't talk to their colleagues at work. They keep it a secret. Some even keep it from their friends, and some even from their family. So it's a huge stigma that's still, and part of it, and I think, comes from the fact that we continue to publicize instances where people with HIV are criminalized, and whether it be unprotected sex or donated blood sort of thing. I think we need to think very carefully. Is it counterproductive?
What are some of the policy changes that Action for AIDS has successfully lobbied for in order to improve the welfare of HIV positive people?
From very early on, one of the first knee-jerk reactions in the 80s was that everybody who died of HIV had to be cremated within 24 hours. So there was no opportunity for any mourning or wake or any of that sort. Even Malay Muslim patients had to be buried in a coffin, and it was sealed, which is obviously against the cultural traditions. So we managed to, as the scientific evidence mounted, that that they weren't infectious just because they're dead. Unless you have sex with a corpse, it's not going to transmit that way. So we managed to provide period of grief and mourning. They didn't have to be cremated within 24 hours. That was one. The second was really, we had, in the early days, there was some, and there still are, infected spouses of Singaporean men. In those days, they were thrown out. So you're literally splitting up the family. So we managed to get that reviewed as well. And over the years, we've been advocating for access to medications and treatment. As I said, treatment is extremely effective, but extremely expensive. Singapore, we are a developed country. We didn't fall into a category where we could use generic drugs, and certainly we didn't declare HIV to be an emergency that we could provide compulsory licensing and importation of generic medications. So all the medications initially were all proprietary, were extremely expensive, could go into thousands of dollars a month. And remember that this is lifelong treatment. So it made people very, those who couldn't afford it had problems going on treatment and staying on treatment. So we've had over many years argued for greater access to affordable medications. And I think in 2010, the Ministry of Health allowed some claiming from Medifund. 2016, we could claim the medications from MAF and MAF Plus, which is other types of assistance. And last year in 2020, I think some of the medications were put on the standard drug list, which is, I think, great news. It certainly made access to treatment more affordable for many patients. So I think that's important as well. And I think more recently so one of the things which I think, it's the advocacy part which is tricky. And if a person who is non-Singaporean, say an employment pass or whatever it is, and they over some time were diagnosed, and as you know, they get periodically tested for HIV. If they're HIV positive, they get thrown out of the country, and they're not allowed in again. They're sort of on a permanent sort of ban. So we've tried, and we succeeded in saying, why do you want to ban a person just because they're HIV, right? It doesn't, it certainly doesn't help in disease control, especially if the person is on treatment. We know that already. So I think that's been sort of changed. So they don't permanently ban people who they know, because we used to get 10 million tourists a year, right? Do we test them? So we don't obviously test 10 million tourists a year for HIV, nor is there a reason to. But it's not inconceivable that a significant minority may have HIV, right? So that's important to remember. Whereas you have a person who is diagnosed in Singapore, they go overseas, get treatment, they want to come back and visit friends or relatives, they're not allowed to. So there was a lot of this. There was a clear, it's completely illogical from that point of view. Why are we not allowing people with HIV from living and working in Singapore if they're non-Singaporeans, if they're on treatment? And we don't pay for treatment of foreigners. Okay, they're all private patients. They get treatment elsewhere. If they're optimally treated and have certain skills and abilities that we need, why and someone's willing to employ them, why can't they come and work in Singapore like any other person with a chronic illness? So I think that we really need to relook at our attitudes and our opinion, because times have changed so rapidly. We're not living in the 80s, 90s when understanding of the medical aspects and the rapid progress of science has completely changed how we should be looking at people with HIV. So I think that's another thing which I would like to see happen as well.
The HIV Registry League placed a renewed spotlight on the intense social stigma that HIV positive people face in Singapore. Has Singapore made any progress in treating AIDS as a medical condition rather than a moral or social stigma? And what do you feel needs to change in the future?
I think over the years, the ministry, the government, and ourselves and other groups have really been campaigning to reduce and to stop the stigma and discrimination. I think we definitely have made a lot. It's come from the efforts of all of us, and it comes from the fact that it's not a fatal disease, and because it's not a fatal disease, people are not so fearful. And when there's much less fear, there's no more that instant pushback and revulsion. So I think that certainly changed over the years as well. I think that society's become generally more tolerant, more accepting of diversity and so on. I think people are much more understanding, and even religious groups are all very much against stigmatization of individuals, people with HIV or people who might be at risk. And I think it's changed. I think it's changed a lot. What has not changed is, I think needs to work is really the people living with HIV are very much, they tend to self-stigmatize a lot. over the years, what we've been trying to do is to encourage people living with HIV to come out and talk about it in public. And we've been relatively successful. That we've got several people who are out there talking about their HIV experience and so on, to try to make people understand that how they need to be treated, and the problems they face, and what the rest of society can do to help them cope. So that's changed somewhat, but many are still very much fearful that they might be discriminated against. I don't downplay or disregard that fear. I think that particularly fear of losing their jobs is very important. I think that there's no guarantee that their employer is not going to fire them or look for another reason to fire them at the earliest opportunity, because there are no guarantees. There's no security really. So the issue regarding employment is probably topmost in their mind, especially if they have to pay for medications and so on and so forth, and it's a lifelong infection. So still work to be done. There's still work to be done in terms of insurance, health insurance. Right now, I think only one or two insurers may actually cover HIV if it was not a pre-existing condition. So top of the mind of people living with HIV is the cost. Is how do they keep going? How do they keep their jobs? How do they pay for their medications? How do they keep their relationships keep their family going? If they've got dependents, how are we going to continue living a life? Okay, so I don't blame them for feeling fearful. So we have to look for ways of trying to reduce those real fears.
Now, looking back at those early years when AIDS was such a frightening situation to face, what do you think was the impact of that whole situation on Singapore?
In the midst of the spiraling epidemic in Singapore, the gay community really mobilized around HIV programs, AIDS programs. It was very, very exciting and very interesting, very rewarding experience. How community, which was criminalized and very much stigmatized, could get together. So it's not just in Singapore. It actually around the world, from the US to all around, even in Asia, Singapore is no exception. And we managed to start programs, activities, projects, groups, support groups. It was incredible, very exciting in those days. Bear in mind that this is way before the internet as well. So we mobilized using phones, using pages and fax machines and so on. And we managed to come out with lectures and talks and all sorts of ways to reach out to the community, to talk about condom use, talk about prevention, talk about care, talk about diagnosis and treatment. And that sort of thing was so much so that it's 2 or 3 decades, but the way we communicate now is completely different, as we all know. And certainly the younger generations, their idea of what happened of the gay plague, as it were, is really they're not very aware. I think that there was recently a series called "It's a Sin." I think it came from the UK, 5-part series for television. And when I watched it reminded me of what happened in the 80s in Singapore as well, where there was ignorance, there was fear, and there was absolute terror regarding the possibility of being HIV positive and dying from AIDS. There's no treatment and only pain and suffering. And maybe that it's certainly a good reminder of what happened in the really dark days of the epidemic. So, as I mentioned earlier on, the treatment and prevention is completely radicalized now. There is, as we know, there's PrEP or pre-exposure prophylaxis, which is you can say that it's like a medical condom, as it were. It protects against HIV if a person takes the medication either on a daily or on-demand basis. Very effective in stopping HIV. There is, in fact, talk about us in Singapore. One of the things, in fact, the main task, the main objective of Action for AIDS is really we have a blueprint to end HIV by 2030, and many other countries have got similar targets to stop HIV/AIDS from being a public health emergency of any importance. And we feel that we can do it because Singapore is a small country. It's got educated population with access to a lot of information and technology and treatments and that sort of thing. We only need the will and certainly the coordination, collaboration with partners and other stakeholders to stop the transmission, because the treatments are so effective. I mentioned earlier on, treatment of in persons can stop the spread, because it's U equals U is another mantra we have. Undetectable equals untransmissible. People with undetectable viral loads cannot transmit. So if you get enough people on treatment, they can't transmit to their partners. And if you have enough people on PrEP or using condoms, they will then stop getting infected. So we just need to reduce the stigmatization, discrimination which people feel, and to get more people to come and test so they can get on treatment, and then get PrEP scaled up to people who need it. And also, so I think that of course it's easier said than done. There's a lot of things we have to overcome, but that's what we are targeting.